Hi everyone, my name is Ophelia Boma, and I am here to educate you on how to become a clinical psychologist in Ghana. By the grace of God, am a clinical health psychologist, and I believe I have the first-hand experience to step by step show you how to become a clinical psychologist in Ghana as well. Before I say much, I would like you to know that I am actually delivering this message to the best of my knowledge, and I may not be able to provide you all the answers in this one sitting because I'm trying to limit this to say 10 or 12 minutes video. And so, if you have any question, you can comment it or you can even inbox me and I'll be there to help you as well. As some of you have known me or have seen me on TV or on radio discussion or some other events, I'm a young advocate as I'm so passionate about mental health. And I believe that through mental health, we can have a quality life. So, who is a clinical health psychologist? Okay. A clinical health psychologist is someone who is trained to assess, diagnose, and treat mental, emotional, and behavioral disorders. This often includes therapy, psychological testing, case formation, and sometimes working in medical settings. An example is a hospital. All right. There are also other discipline in psychology called the school psychologist or the educational psychologist or even organizational psychologist where they work at different settings as well. Now, someone would ask, what is the educational or regulatory pathway here in Ghana? Ghana has these defined regulations that govern psychologists in Ghana or even mental health professionals in Ghana. So in Ghana, there are some specific rules, and this is what number one is your education, number two, accreditation, number three is licensing, okay, and this is governed by the Ghana Psychology Council, which we call the GPC, under the Health Professionals Regulatory Bodies Act 857. So to become a clinical psychologist, you have to undergo the education, the accreditation, and the licensing processes to become one. Now, the steps include your secondary education, all right, what you did, and then how it is relevant to you becoming a psychologist in future. That is, if you completed a senior high school with strong performance in some relevant subjects. We all know in Ghana you have to do well and pass all your core and then some electives to make up the cutoff point to gain admission into the university. And so your entry to the university will require you to have very good grade from your senior high school. And it would be good to have background in the sciences where you did maybe biology or chemistry or physics, so a science background that will help you to start greatly in your undergraduate. Now, second is your bachelor's degree in psychology. You need to get enrolled in an accredited institution, okay? An example, it could be a BSc or a BA in psychology or related fields in psychology, which could be sociology, which could be like the humanity courses, okay? Bachelor's degree in psychology or the related fields is a good fit for you. It's more like a stepping stone to becoming a psychologist. So that is normally 4 years. However, some people have combined. I know that you has a combined BSc and a master's in psychology, right? Now let's go to the third step, okay, is to have to complete your master's, and your master's must be research. After your bachelor's, your you need to further education into master's, and it has to be research, either MPhil or some MSc have some research, but it should be research based. Minimum of 2 years, right? 2 years with an additional internship or practicum, which is an enhanced training to learn. So your master's actually includes your coursework, your practicum, and then your thesis, right, which is your research. Yes, some other schools you complete. So let me just state an example from UCC. I attended UCC, and so we did clinical health psychologist, right? And this was 2 years. So in our first year, we did our coursework. In the second year, we're doing our practicum hands-on training in a clinical setting. Okay, it was 300 for the first semester and 300 for the second semester, whilst doing our research work. All right, and at the end of the day, after we were done with school, we had to come back again and continue a 1 year, more of 600 hours on hands training in a clinical setting. So in all, it's about 3 years. Let's take 4 years bachelor's, 3 years master's, and practicum or your residence, which is going to be like 7 years. Okay, so maximum you need 7 years to become a clinical psychologist in Ghana. And after your masters, okay, and now you have gone to the clinical setting to do your practicum, it has to be accredited by the Ghana Psychology Council. The psychology program must be accredited by the Ghana Psychology Council. Also, the university must be accredited by the National Accreditation Board. So you don't just go to any other university or any other health setting to work. This is hardly regulated by GPC, like they'll do their work diligently. And so the GPC accredits the course content for the psychology that you're doing. So if you find yourself in any school doing psychology, make sure that it is accredited by the GPC, because they make sure that these are all followed, sure that the school is accredited and the courses are also accredited as well. Now, your internship, after you are done with coursework and your internship, you're doing your internship in a clinical setting. Okay, I chose a clinical setting because I wanted to have the on-hands training as well. You will have to make sure that you get a logbook, because when you go to GPC, they'll surely give you a logbook. You may print it out if you want to write in, or you may just fill it as a soft copy, like whatever you do. So you keep on filling whatever you do, and it includes the cases that you have seen. This is normally your casework or case that you have assessed and the interventions that you use that worked. And when you are done, you log in and you sign on every page. When I say every page, I mean if the pages are 500, you need to sign on every page. The supervisor will sign. They'll go through evaluation form. They'll also write some evaluations for you. You will write your report as well. It's a very exciting experience. And when you are done, you can now, with your logbook, apply for licensing. I don't want to talk much for the GPC processing. I'll do that in another video, like how to apply for your license. Now, when you apply for your license, it may take just few weeks for you to get it. After that, you would go through the induction, take pictures now. You will now be inducted. Normally, this is done every year, like every December. Now, the schools for you to apply for your master's, I know of UHAS, okay? They even have specialty into neuropsychology and clinical psychology as well, and University of Ghana, where they do clinical psychology. It's also a research program, 2 years as well. And lastly, it's University of Cape Coast, where I graduated. And so you can also pursue clinical health psychology as well. So these are just the short steps that I know of to becoming a clinical psychologist in Ghana. Number one is your senior high secondary school. The courses and then your grades should be best enough to grant you an entry to a university. When you go to the university, you study psychology or psychology related courses like the humanities, okay? An example is sociology. After that, after your degree, right, you go through your 1 year service, the national service scheme. So after that, you go back and do your master's, and it should be a research master's program, which contains your coursework, which contains your practicum, and then your thesis. And lastly, your 1 year graduate internship with a recognized clinical setting. Okay, so what I would also advise or things for you to consider is number one, practical experience. Try to gain experience a lot. Like, don't just be relaxed. Don't think, oh, this is a 1 year of paid internship, and so I will just go 2 or 3 times a day and all of that. No, volunteer. I remember my time when I was even done with my practicum, I went back again to volunteer just to learn about the work. I was so intrigued about knowing psychology and I wasn't paid, but you just invest for the future, okay? And number three is research skills. You need to gather momentum when it comes to research. You need to know your work. You need to volunteer to work with other research bodies like NGO or mental health clinics. Like, you need to understand your data. You need to understand how data works when it comes to psychology because it will help you in your work. Number three is to understand your specialty. Like, where do you really think you would work best? Is it in school? Is it school psychology? Is it clinical psychology? Is it health psychology? Is it organizational psychology or political or sports psychology? Like, you really need to understand yourself, like, know thyself enough to choose a specialty that you can really live at large. Like, you can become, like, you feel at home working in that specialty. And number three, ethics and professional code of conduct. See, to become a psychologist alone is a character builder. It refines your character. It refines how you talk, where you talk, confidentiality, anonymity, ethics, and all of that. To become a psychologist is a whole life changing journey because it takes you through your own life. If you have trauma, it will help you to even understand your own traumas and work around it and seek for help. I remember when I first started, I was told that I need to go through therapy, like something has to be solved in my life. And I accepted. I really went through therapy of certain things and then I had to be refined and I was refined as well. And so now people can tell that yes, indeed, I am called in the profession because when you accept to go through the process, you will come out refined and meet for the master's use. And when I say meet for the master's use, I mean you become the profession. The profession goes through you and it refines you, it defines you, it brings out a certain um it brings out a level of competence that only when you are able to go through the process will you become that. And lastly, language and cultural competence. Having worked in Ghana, know some local languages, it will help you a lot because in mental health support and services, we believe in what cultural competence services. You must be able to relate with your people. Either you speak their language, understand their beliefs, their norms, their culture, and you should become very sensitive to those things as well. So that you are careful to provide them the services that they need. So always have that at the back of your mind that you want to provide culturally competent services to your people. Someone may ask, how about funding? Well, I know if you're a graduate student, you get a little funding from the government called the bursaries, right? And sometimes they have other funding in the department where you can apply, and if you win, they give it to you. But I didn't have any funding or scholarship. I actually paid my own fees, and I was able to graduate and everything. If you have any questions, let me know. I'll be here to answer them. Bye.